Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. And glad that you can be with us on today's program. Recently, we've had World Hypertension Day observed in Guyana and around the world. And on our program today, that will be our focus, hypertension. I've got with me two doctors, Dr. Dianelli Drapal. She is the coordinator of the Chronic Disease Department of the Ministry of Health, and Dr. Baldev Singh from the Nephrology Department of the Georgetown Public Hospital. Doctors, welcome to our program. Dr. Drapal, I'll start with you. So tell us a bit about your disease, your department, Chronic Disease Department.
Okay, thanks for having us on the program today. Well, the Chronic Disease Department, as the word chronic means, that is something that you cannot cure. You will have it for life.
Mm-hmm.
So basically, we look into all of the major chronic diseases like diabetes, hypertension, cancers, respiratory diseases, and diseases, hematological diseases.
Mm-hmm.
So now that we're observing World Hypertension Day, I would like to talk a little bit of the program that we have,
Mm-hmm.
which is HEARTS. If you check online or what is going on in Guyana, you would find that a lot of persons are hypertensive.
Mm-hmm.
According to WHO, more than 50% of the world's population suffers from hypertension. And almost 2 million persons have died in the previous years owing to cardiovascular diseases. So this is a major area that we have been paying keen attention to. In 2018, the Ministry of Health, we bought into the HEARTS technical package, which is basically looking into hypertension and other cardiovascular diseases. So last year, we started a pilot in 8 health centers, like Eccles Industry. We have Anna Regina, Letem, Port Morant. These health centers, they offer the HEARTS technical package whereby we have introduced new medication within the health system, such as telmisartan, chlortalidone. We never had these medication before in our system, and we're finding that we're having great results. Before, within the health centers, we never used to do certain laboratory tests. Patients would have to go to Georgetown Public Hospital to seek tests such as total cholesterol and the HbA1c. But with the HEARTS technical package, we have point-of-care machines whereby there are little machines that we place strategically in these facilities, and the patient would go to the health center and they'll be afforded these tests. So it's economical for the patient because it's patient-centered. You're having the treatment and the labs within your community.
All right. So let me come back, and we've got a couple seconds in this first segment. So let me bring in Dr. Singh here. For viewers who might not know, and for those who know, but might be looking for something simple, what is high blood pressure?
Well, thanks for having me. Firstly, blood pressure is basically the blood that flows within the arteries. High blood pressure is when that value that's supposed to be normal is elevated. And when you check your blood pressure or someone checks it for you, there are values that you should know. And the basic definition would be when it's above a certain level. There's 2 readings. There is the systolic, which is the top number when you look at the machine. And then there's a lower number, which is called your diastolic. The systolic is basically when your heart contracts, and the diastolic is when your heart relaxes. So that's the 2 different readings that you get. The most common definition that you'll find is when it's above 140, which is the systolic number, and when it's above 90, which is the lower number, which is the diastolic. And that basically is the definition of hypertension.
And of course, they always say that your ideal blood pressure level should be 1.
So ideal, it depending on the person and their risk factors.
And their age also.
And their age as well. But ideally, anything below 138 would be perfect if you're diagnosed with hypertension. If you're not diagnosed with hypertension, then 120, less than 128, it would be perfect.
Okay, so we'll take a break, and when we come back, we'll be talking more about hypertension, as in Guyana we would have recently observed World Hypertension Day.
What do you call it? Cold one, hard stuff, booze, liquid courage? The list is long, as is the list of its effects on the brain and body. We know the behavioral changes, we've seen it before. Slurred speech, changes in mood, unsteady walk, or even total loss of consciousness. It can cause other bodily damage too, like damage to your heart muscle, high blood pressure, stroke, liver damage, immune system suppression. It's also a known risk factor for cancer. Those are just to name a few. What about the people around you? Alcohol can influence domestic violence and cause road fatalities. Don't cause or become a statistic. Stop. Think. Don't drink. A message from the Ministry of Health Chronic Disease Unit.
Mom, why am I fat?
One in 3 children in the Caribbean is overweight or obese. 41 million children under 5 years, 340 million children between the ages of 5 and 19 were overweight or obese in 2016. They are more likely to become obese adults, have an increased risk of early onset diabetes, heart disease, breast and colon cancers. Obesity is preventable. Make healthier food choices and engage in regular physical activity to reduce childhood obesity. A message from the Ministry of Health Chronic Disease Unit.
Welcome back to our program. So we know now what is high blood pressure. How can someone who is suffering from high blood pressure, Vera, they might now ask the question, how do I know? Of course, we know when you go to the clinic, they'll put you on a machine and you will know. But sitting at home, how do I know?
So, about hypertension, there's basically no symptoms. Most of the time, it's silent. So that's why it's recommended to check. Especially above the age of 40, you should at least have every 6 to 12 months one check of your blood pressure. The symptoms start to arise when it's very elevated, and the most common symptoms would be like headache, neck pain, and then there is the...
Like actually, most people who's got a pain at the back of the neck, immediately they say, and sometimes it's not. As case me, no, yes, I just remember that one. It's there. The man said once you get the neck pain at the back, it's high blood pressure. Yes.
Yes. Well, sometimes, not all of the time. It could be stress. It could be lots of issues that can cause that. But some of the other symptoms that you will get is when you have what we call end organ damage. Like it's really high for a long time. You didn't notice it, but then it starts to affect your eye. You may have like blurry vision. You may notice lots of your urine becoming very foamy. It's affecting your kidneys. It can affect your heart as well. You start to have, especially with the heart's pockets that we're having, it can affect your heart, leading to higher risk of having heart disease. So there's like, you can have chest pain. So there are multiple things that can happen when it's elevated for a long time. But initially there might not be any symptom.
What causes high blood pressure?
Well, in some cases it's idiopathic, meaning that we don't really know the cause, but stress, a lot of salt intake could cause high blood pressure.
What you would see most common in your patients?
So most of the patients, 80 to 90% of them, as Dr. Tripal mentioned, are idiopathic. You don't know the cause, but there are like 10% where there's other causes, and though if you know the cause, if you investigate it, you might be able to reverse the high blood pressure, and that would be more common in younger patients that comes with high blood pressure. So you'd want to investigate those things, but most of the time there is no cause. Also genetic and the lifestyle, high salt intake, alcohol use, smoking, a sedentary lifestyle.
And just to add what he's saying, that's what the HEARTS technical package is addressing. If you look at the acronym HEARTS, H means healthy lifestyle. The E, evidence-based protocol. A, access to medicines and technology. R, risk-based cardiovascular management. The T stands for teamwork, and S means systems for monitoring. So we look at all the risk factors that one may have and try to address them. As Dr. Balio was saying, salt intake, we try and counsel the patient. We have a nutritionist within the department that would sit one-on-one with patients and guide them on how to prepare a meal. This is not only for hypertensive patients, but other patients who may be diabetic, who may have some kidney problems, and so we do counseling with them. We also do tobacco control. Later on in the month, we'll be launching our tobacco cessation clinics, whereby if you're a smoker, we will try to assist you in quitting because we know that tobacco is one of the risk factors, amongst other things we've been doing within the department.
Doctor, you mentioned about, once you're 40 years and over, that you should really start to, make testing for hypertension part of your medical package. That doesn't mean once you're below 40,
No, definitely not.
I'm good to go there, right?
Yeah, definitely
Who
not.
gets it, really? Can someone under 20, 24?
Yes.
Yeah.
So it depends. As I said, there are secondary causes where patients with common in females would be patients with thyroid problems can have hypertension. The most common secondary causes would be hormonal problems and then kidneys. So patients that have kidney problems and endocrine problems or hormonal problems would be the most common cause of secondary hypertension. So if you're younger, you can definitely have it if you have these issues as well.
You mentioned stress also as possibility being one of the risk factors. Of course, we know what we're living in a world, so much things to do. We have so much deadlines. We have so much of, lots of things happening around us. Would you say stress is really an important factor here? And someone mentioned lifestyle also, but stress is part of our lifestyle these days, always trying to meet a deadline. Your thought about stress?
Yes, stress definitely is one of the factors that could influence one in having hypertension. That's why we stress that patients should take part in some physical activity that helps to relieve stress. Meditation also, yoga. These are things that are activities that will help you to lower your stress level.
Stress?
Yes, definitely. Especially if you're stressed, you're on the obese side, you eat fast food, especially if you work in an environment where you don't have access to healthy food. Your first goal is either fried chicken or pizza or something, very high level of salt. All those factors combined will definitely lead you to have hypertension.
You mentioned that it's a silent disease, a silent killer in some cases. But does it, once it's not treated, can hypertension cause damage to your body?
Definitely. So I'll start from your head to your toe. So in your eyes, it can cause something called hypertensive retinopathy, where you may start with blurry vision, but then you lose your vision because of hypertension. You may start to have like bleeding at the back of your eyes, as it's commonly known, similar to what diabetes can cause. Then it can increase the risk of having heart attacks as well. Going down, it can cause something called hypertensive nephropathy, where it affects your kidneys as well and lead to kidney failure. Those are the most common areas that it can affect. And then what we find commonly is that patients can present initially with a stroke. And the most common type of stroke would be a hemorrhage. And that's very dangerous. So definitely hypertension is considered a silent killer, because when it happens with one of your organs if you don't know before.
I know over the years it's always a main factor when it comes to pregnancy, especially from the women's perspective. And Doc, maybe you could tell us about that.
Yeah, so high blood pressure in pregnancy is something that we definitely we're keen on. We always encourage pregnant women to join your clinic early, because we have a habit of joining after 3 months. But as soon as you know that you're pregnant, we urge all pregnant women to join your clinic so your basic labs can be run. One of your vital signs, which is your blood pressure, is taken on your first visit and on all your visits. So it's definitely something that we look into.
What happens if you have a pregnant woman and her levels are elevated?
High blood pressure, it could cause eclampsia. It could cause death in the fetus and the mother. So this is something that we really need to be keen on. And The mothers, as we always urge, if you had a pregnancy before and you notice that you had high blood pressure, you should seek treatment all the time, because you would find most of the pregnant women, after they got the baby, they don't go to clinic and they're lost to follow up. And this is something that is very dangerous. So if you become pregnant the second time, you might find that their pressure is sky high, and we don't want to end up in complications.
Let's talk medication here. We know that there's a culture in Guyana, in some areas, where people self-medicate. And the thing is, and they self-medicate even by not getting medication from a doctor. That they would go to maybe a pharmacy or a friend who will test their pressure. And then the friend will say, well, I use X tablet. And then so well, like, give me a few, let me try. And then they take that tablet X and they go to the pharmacy and say, can we have tablet X? And then they treat themselves with tablet X. Is that really a good thing?
No, it's not advisable. First, what we try to teach patients is you need to see the right way in taking your blood pressure, because if you come off of the road, your heart is racing and all these things, and your blood pressure might be high. So we urge patients to at least sit 10 to 15 minutes before you take your pressure. That will give you a more accurate reading. Mm-hmm. Also, the type of machines that you're using, if it's calibrated or not, that could influence too in your readings. And we urge patients to seek our medical advice, because if you use certain bush and these things, we do not know the exact dosages and what interactions it could cause with pre-existing medications that you're using. So that's why we urge patients to seek medical advice before going and take something, because something might be good for you, but it mightn't be the right fit for me. I might be allergic to it. We don't know.
Is there a specific medication for specific persons or specific circumstances in a person?
Yes. So, for example, let's say you have a heart disease. Mm-hmm. You were seeing a cardiologist and he placed you on a medication. And then you go to your friend and he also gives you another medication, which is in that same group of medication. And it tends to lower your heart rate. So if you double on the dose of it, it will drop your heart rate very low. So that's why it's any medication, especially if you're hypertensive, you should seek consult with your primary healthcare physician or whosoever is your physician, to make sure that there's no drug-to-drug interaction and it's not harmful to you. Because there's different risk factors. So like diabetic patients have their own medications, antihypertensive, that would benefit them. Heart disease have their own medication that would benefit them. African descent have certain medication that makes it that wouldn't help in bringing the blood pressure too low. So you need to know which one is working for them. And different diseases have different indications. So definitely seek medical advice before changing or adding any medication.
And doctor, your take on persons who use herbal medicine that is not calibrated, as case may be?
So herbal medicine, the first thing is that we might not know the right dosage, that Dr. Tripal mentioned earlier. And then there's a lot of interactions. So we don't know if it can cause more harm, and it can also affect other organs in your body when you take it. So definitely before going to take herbal medication, try the medications that are studied and are known to reduce blood pressure rather than going to the herbal route. I know the Guyanese population, especially men, they tend to say that they don't want to go on tablets. So, but that's what's studied and recommended. So if you want to go the right way, then seek consult with your doctor.
We'll take a break, and when we come back, we'll wrap up our program on Health Matters. Don't go away.
What does a healthy plate look like? It's made up of whole grains, healthy protein, vegetables, and fruits. Let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Avoid those refined grains like white rice and white bread. Healthy protein. Choose fish, poultry, beans, and nuts, limiting red meat, cheese, and avoiding processed meats like bacon. Fruits and vegetables. Eat a variety of fruits and more green and other colored vegetables daily. They provide a variety of nutrients, antioxidants, and fiber, which build the immune system, prevent obesity, and promote healthy, youthful skin. Use more organic seasonings and less salty products like aji cubes and packet or bottled seasonings when preparing meals. And lastly, stay hydrated. Drink at least 8 cups or pints of water daily. Tea and natural fruit juices are great options. Avoid sugary foods and sweetened beverages. Eat well, keep moving. A message from the Ministry of Health Chronic Disease Unit. Exercise gives you more than just a great body. Some benefits you can't see, but you can feel. Cardio increases your heart rate and improves circulation. 60 minutes is good for heart health and 30 minutes for overall health. It helps boost your immune system, eases your mind, and rejuvenates your body. Now let's talk muscle. The more muscle mass you have, the more fat your body burns while resting. A pound of muscle burns 3 times more calories than a pound of fat. So having more muscle means you can consume more calories. Exercise can improve the look of your skin, boosts your self-confidence, and helps you sleep better so you can wake up and do it all over again. 30 consecutive minutes per day, 5 days a week. Start now. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health.
Welcome back to our program, our final segment. We've been talking about hypertension, which disease that problematic, silent killer, that is being touted here on our program today, and something that Ministry of Health is looking seriously into. Let's talk back about the work done at the clinic and encouraging people to visit. I mean, people should be engaging in having, your standard medical checkup, and then you will know what is happening, and then you can channel people into clinics, specifically the heart clinics. So just recap about these clinics.
So basically, all of the health centers, they offer chronic disease clinic. It's once per week, but we have some centers that do offer twice a week. It depends if they have a high catchment area. So we urge all patients, you should visit your center. If you're hypertensive, you should go regularly to your clinic. If you're not hypertensive, we urge persons to go at least once a year to have a general physical.
And the thing is, you have tons of medical outreaches happening countrywide, and almost all of those outreaches do have a little table there to set up to test your blood pressure. And I'm quite sure once those outreaches see the blood pressure, they will navigate you to the nearest clinic.
Yes. Yeah. So regional health services, they conduct a lot of outreaches, and our department also, we've started workplace screening, whereby we visit a number of workplaces, like 4 to 5 workplaces during the month. And when we identify patients, we send them to their nearest health center to continue treatment. They will have the treatment, their start treatment, and then they're referred for continued treatment at their health center.
As you speak of that, let me just quickly put you on pause. So in the event there are a workplace looking there, and they would like your department to come, how can they make contact with you?
Okay, so they could call the Chronic Disease Department at 223-7355 and express their interest. Right now, we have a list of 55 workplaces. So as I said, 4 to 5 we do per month. So if you call, you will be placed on a waiting list. It's not that we will see you right away, but during the course of the year, you will be seen.
But then everybody should really get into one of those clinics and ensure that if they do have a high blood pressure, that they're channeled into one of those centers that they could be taken care of.
Yes, we urge all patients. And as I said, the Heart's technical package, it was piloted in 8 centers, but for the year, we have done baseline assessment in 85 facilities. So by the ending of the year, at least 95 facilities should be offering the Heart's technical package.
And what's the service offered at the GPHC?
So GPHC is mostly a referral hospital. So it would be for these patients that are complicated, they're on 3 to 4 medications and not being controlled. Then you go to a specialized clinic to see them. But most of the time it's referral from the health centers or the other hospitals that we see.
And the medication, you said there's some new medication. Does medication really work?
Yes, of course. Once you take your medication as prescribed by the doctor, because you would find patients, they would say, okay, my pressure's high today. I'll just take the tablet today. My pressure went down, so I'm not going to take it until it's high.
Is that non-adherence?
Yes, definitely. That's a big issue. Most of the time, because they don't feel anything,
Right.
they tend to say, well, I don't need to take my medication today. I'm not feeling anyway. Only when I get a headache or I feel the back of my neck hurting or I feel a bit off, then I'll take my medication.
Or they're going to stay home for the weekend, right?
Yeah.
I'm not going to take a holiday. There's no holiday for blood pressure meds.
No, there's no holiday. You need
Right.
to take it every day so that you can have it at the level and
At the level.
controlled.
Right. And it's always important to speak to your doctor in the event there's going to be changes and so forth. Very quickly, doctor, you spoke just a bit about it. The machines that they have out there, how good, how bad, how usable are they, and do they give accurate information?
Not all of them are calibrated appropriately and give accurate information. So the American Heart Association, they have the list of blood pressure machines that are calibrated from the US. So if you want to buy a calibrated machine, you should probably go online and check what are recommended. So definitely, because they have some that are used on the wrist, those are not very appropriate to use because it depends on your size of your hand and the size of the cuff and everything and how you're sitting to do it. There's multiple factors involved. So the best way to check it is to have a calibrating machine and done at home and at the office when you visit the doctor, so you can have an idea of how it is, rather than you do it at home and it's low or high at the office and there is a difference. So you have an average when you do it at home and at the office.
And wrapping up, Dr. Japal, is it important? It's important for people to take health into their hands because health matters. What would you want to tell somebody who is hypertensive, but they don't want to come and see the doctor?
Well, I urge you to see your doctor. As I said before, the onus is on you. Nobody else cannot look after your health. You should practice lifestyle changes and you will see that you will live a long and healthy life.
Dr. Singh, why is it important to see the doctor?
The same thing, I would echo Dr. Japal remarks. Lifestyle changes and taking your medications, because if you're living, you want to live healthy. You don't want to be going to the doctor all the time and then have complications where you're living but you cannot see, or your kidney is failing, or you have a heart attack and so on. So you want to be healthy as much as possible, and the way to go is know what your risk factors are and treat them and see a doctor whenever you can.
I always used to say, people out there should really have one ambition, put doctors out of a job. This has been Health Matters. Thanks a lot, Dr. Japal and Dr. Singh, for being on our program. We're talking about high blood pressure. Please do stay safe. Do join us again for another edition of Health Matters. Until that time, be safe.